Soos Jennifer nou vir jou gesê het, praat ons nou 'n bietjie oor Measles en Dr. Patrick O'Connor van die Wêreldgesondheidsorganisasie sluit vanoggend by ons aan. Hy praat al die pad uit Geneva in Switserland saam met ons oor die onlangse toename in masel-gevalle. Doctor, good morning. Thank you so much for joining us here on CakeNet this morning.
Good morning, and thank you for having me here, and I look forward to talking to you about measles.
Let's perhaps start with just painting the picture of what the situation is like internationally at the moment, and according to your knowledge, how South Africa compares to the rest of the world when it comes to measles.
Sure, thanks. So currently we're seeing quite a few measles cases globally, and the numbers have actually from 2022 into 2023 have doubled in the number of measles cases reported. And the number of cases reported actually represents a very small number of the actual cases globally. It is an underreported disease. And, we have a lot of concerns because it's more than just a fever and a rash, which people often think of. It includes a cough and a runny nose. And some of the more serious complications include pneumonia, and can even result in blindness, deafness, and encephalitis in more serious cases.
Doctor, in your assessment then, as the WHO, what do you attribute this significant increase to?
Yeah, so I think one of the big issues is that we've had a lower number of vaccinations contributing to some of the gaps in the programs that provide routine immunization since the COVID-19 pandemic. So we're still really in a recovery phase right now. But unfortunately, measles is one of the most infectious vaccine preventable diseases we know of. And so if there are any immunity gaps, so people who have not been immunized, the virus is able to find those individuals and cause significant amounts of disease globally. And also currently quite a bit of outbreaks in sub-Saharan Africa and Southeast Asia and the Middle East in particular.
Doctor, I have to ask, there are a lot of people that are still skeptic about vaccinations in general and, for example, the measles vaccination. What would you say to those people? Are there any side effects if you do get a measles vaccination?
Sure. So the measles vaccine is one of the oldest vaccines that we know of. It's more than 50 years old currently, and actually billions of doses have been given globally. And it is really the only way to prevent this sort of serious disease and the serious complications that are associated with this disease. And there are the very similar side effects to what you get with any other sort of injections, mostly related to, injection site soreness and a little discomfort. But it is a very, very safe vaccine. And anybody who hasn't had the vaccine should really, either if they've missed a dose or if they're unsure, they should check with their local healthcare providers.
I just want to continue on that thought of my colleague, Doctor. As the World Health Organization, what strategies do you have in place to help allay the fears that people are having all over the world at the moment when it comes to vaccinations? As she said, post-COVID-19, there were a lot of conspiracies and a lot of things happening around it. What strategies do you have to really help people understand and to show to them, to prove to them that this is safe?
Sure. I think that's a really, it's a big concern with individuals globally and, within individual communities. And I think one of the best strategies we have currently is for individuals to go to trusted websites, the WHO website, as well as the US CDC and other sort of globally recognized institutions. But I think one of the most important is to go to your trusted healthcare provider, whether it's your pediatrician or your general practitioner, I think these individuals would be able to give you the most current information for your local area, whatever the routine immunization schedule is, but also would be available to answer any questions you have about whether you're eligible or any of the significant issues associated with individual diseases. We're currently talking about measles, but there are other significant diseases, diphtheria, polio, that are also of concern, and were also significantly missed opportunities during the COVID-19 pandemic that we are currently trying to work with individual countries and areas in order to help them catch up and get back to those levels pre-COVID-19, but also to increase those levels beyond.
Doctor, you touched on it earlier. I just want us to go back to the severity of measles. As you say, sometimes
Sure.
people don't quite understand the consequences of having measles. So perhaps talk us through the symptoms once again, so that should there be somebody that perhaps are experiencing any of these symptoms, they're aware that it could possibly be measles.
Sure. And so just to remind everybody that measles is a person-to-person disease. And it's usually through coughing or sneezing of an infected individual. There is no animal that spreads it, so it's only from people to people. And symptoms usually occur in 1 to 2 weeks after the exposure to the sick individual. Some of the symptoms are a very high fever and rash, and then subsequently, 2 or 3 days after the cough and the high fever, you get the rash that sort of covers the whole body. It's coughing and sneezing, and then that often can progress into serious side effects such as diarrhea, and often, sort of pneumonias can occur. And that's where a lot of the sort of mortality or significant hospitalizations, or even in some rare circumstances, death can occur from getting measles.
Let's then talk about vaccination, specifically the vaccination of children. What percentage of children needs to be vaccinated in a specific area for it to be effective?
Yes, because of the high infectious nature of the measles virus, coverage needs to be extremely high to provide that herd immunity or that sort of community protection. And the coverage number needs to be 95%. So really, really high. And so currently, globally, the coverage for the first dose, it's usually a 2-dose vaccine. The first dose coverage globally is 83%. So significantly lower than the 95% that is needed to stop the transmission of the disease. And that's why we're currently seeing a significant number of outbreaks globally.
Can you get measles more than once in your lifetime?
The measles disease?
Yeah.
It's extremely rare. Usually after getting 2 doses of the measles vaccine, you have lifetime protection. It would be in a very rare circumstances. So it's, as I said, it's an extremely old vaccine. It's been around for a long time, very, very effective. And once you get those 2 doses, you are covered for the rest of your life.
Doctor, perhaps in conclusion from my side, we spoke about the percentage of children that needs to be vaccinated against measles for it to be effective. But there might still be some parents who are still not very comfortable. They might not be convinced, even though we are having this conversation this morning. My question to you is whether there's any other way of protecting your child against measles, or in your professional opinion, is vaccination honestly the only way to go?
Yeah, I would have to say that not only for measles, but for all the sort of childhood vaccines, they're really the only way to get the lifelong protection that you need to not have the disease and not have those serious complications, and really not only protect yourselves, but protect your community and others in the community that may not have had the vaccine yet, or not eligible based on their age, or have some other serious health condition that has prevented them from getting the vaccine. So it's really to protect yourself and your family and really your whole community.
Doctor, once again, thank you so much for your time this morning here on die Groot Ontbyt. We really do appreciate it. Dit was natuurlijk Dr. Patrick O'Connor. Hy is van die Wêreldgesondheidsorganisasie en hy het vanoggend met ons gesels. Al die pad vanuit Geneva, daar in Switserland. Ons praat oor die onlangse toename, kommerwekkende toename, soos hy sopas gesê het, in masels gevalle wêreldwyd.